Sometimes the most profound insights, they come from the most unexpected places. Today, we're diving deep into something really common, something you probably see every single day. Yet, it holds these remarkable secrets to your well-being. We're talking about the subtle yet powerful ways your body communicates through the color and characteristics of your urine. So our mission today is to decode these daily messages. Think of them as like early warnings, maybe surprising insights, really empowering you to become a more informed observer of your own health.
Yeah, it's truly fascinating, isn't it? How the body provides these quiet clues, almost like getting a daily internal report. And understanding these signals, well, it's a foundational step in personal health awareness. But, and this is crucial to remember as we unpack all this, these are just indicators. They're valuable data points, sure, but not definitive diagnoses.
Right. Okay. So let's unlock this internal communication system then. If our bodies are sending these daily reports, what's the baseline? What's the ideal color you should be seeing if everything inside is, humming along perfectly?
Okay. So the gold standard, what you're ideally looking for is a pale yellow color, often described like a clear straw. That's your body signaling good hydration and kidney function. Things are working efficiently. But the spectrum starts right there. I mean, if your urine is completely transparent, almost like water, that usually just means you're drinking a lot of fluids, which, good hydration is great, mostly. But sometimes excessive water intake can dilute essential salts in your body. So finding that balance is really key.
Okay, that makes sense. And what about the other end of that spectrum? When you move away from that pale yellow towards something much darker, what's that telling us?
Right. So dark yellow or even amber, that's a very common and, frankly, pretty clear indicator of dehydration. Your body is basically saying, hey, I need more fluids. It's concentrating the urine to conserve water. Now, if we connect this to the slightly bigger picture, sometimes consistently dark urine can also point to the presence of ketones. Yeah. And this isn't just about hydration levels. It's a little snapshot of your body's energy strategy at that moment. Ketones show up when your body starts burning fat for energy instead of sugars, which can happen with dehydration, sure, but also, as part of certain diets, like keto diets, it's a little peek into your metabolism.
Huh. So it's definitely not just about the color itself. Our body's dashboard might have other indicators too. What if the color seems okay, but something else seems off? Like maybe it's clarity, or even if it looks foamy. Are those different signals? Maybe more urgent ones?
Precisely, yeah. Beyond just the hue, the appearance, like clarity or texture, offers distinct insights. So if your urine looks cloudy or turbid, that could be due to crystalline deposits.
Okay.
Think of them as tiny particles that, well, potentially over time could clump together and form kidney stones or bladder stones. But it can also be a more immediate sign of something like a urinary tract infection, a UTI. That's where white blood cells mix with the urine, giving it that cloudy, sometimes almost milky look.
And the foam you mentioned. We've all seen a few bubbles, right? Especially if the stream is strong. Is persistent foam always a worry?
Right, you've hit on a key distinction there. A few bubbles now and then, usually totally harmless, likely just physics. But consistently foamy urine, especially foam that sort of hangs around and doesn't disappear quickly, that's a more significant signal. It may indicate the presence of protein in the urine.
Protein.
Yeah. Think of your kidneys as these incredibly fine filters, right? Like bouncers at a very exclusive club. Healthy kidneys block large molecules like proteins from getting into the urine. So a noticeable, persistent amount of protein suggests those filters, those bouncers, might not be working as efficiently. And that certainly warrants attention. It could be something gradual, like in chronic kidney disease, or maybe appear more suddenly. Consistent foam is definitely a visual cue that needs observation, maybe further investigation.
Wow, okay. This internal messaging system is, incredibly sophisticated. But before we jump to health conclusions, we have to think about the immediate stuff, right? External influences. What about just the everyday things we eat or take? Food, vitamins, medicines. How do they play into all this?
That's a really important question. How do we tell the difference between, say, a harmless dietary effect and a potential health concern? Let's take bright yellow or even fluorescent yellow urine. Super common, right?
Oh yeah, definitely seen that.
And it's almost always just the result of taking B-complex vitamins, especially synthetic ones. They're water-soluble, so your body uses what it needs, and the rest just gets flushed out. That gives the urine that distinctive, almost neon glow, usually absolutely nothing to worry about.
Okay, that's reassuring. A familiar one for many people, I bet.
Right.
But what about red or pink?
Yeah.
My first thought there would always be, oh, something serious, like a red flag, literally.
And you're right to be cautious. Red can be a serious signal, no doubt. However, it also has some surprisingly common and totally benign dietary causes. Beets, for instance, beetroot. And some berries, too. They can definitely cause a harmless red or pink tint. It's almost like your body's playing a little trick on you sometimes.
Huh.
So the critical distinction, kind of your mental filter, is telling the difference between food effects and actual blood. The simple rule is usually, if there's no obvious food reason you can think of, or if that red color sticks around, that's when you really need to consider other more serious causes. And if it is blood, well, that could indicate things like kidney stones, UTIs, maybe prostate issues in men,
Hmm.
or even something called runner's hematuria, which can happen after really intense, prolonged exercise like marathon running. So it's about context and persistence, not just that initial color shock.
Fascinating. How a simple beet could mimic something so concerning. What about orange urine then? Does that carry the same kind of ambiguity?
Orange can sometimes be benign, maybe caused by certain medications, but it does become particularly concerning if it shows up alongside pale-colored stools.
Ah, okay. The combination is key.
Exactly. That combination can strongly point towards liver or bile duct issues, maybe problems processing or draining bilirubin correctly, which then sort of leaks into the urine in larger amounts. It's like your body's waste disposal system is rerouting things it shouldn't be. So while some meds can cause orange urine alone, that specific symptom combo, that's a much stronger clue that something significant might be happening.
Right. We've covered the more common visual cues now, but what about those really rare colors, the ones you sort of hear about, like black or blue or very dark brown? Do those actually happen? What could they mean?
They are indeed quite rare, yeah. But when they do appear, they can be highly significant indicators. Black urine, for example, can sometimes be linked to certain antibiotics, like metronidazole, or some herbal laxatives, even ingesting really large amounts of artificial sweeteners, believe it or not. Blue is exceptionally rare, maybe associated with specific genetic conditions or even high calcium levels in the blood,
Hmm.
which can sometimes happen with, say, excessive vitamin D intake. And then there's that very dark brown, almost like concentrated black tea look.
Yeah.
That can also be caused by metronidazole, actually, but it can also be a sign of severe muscle injury, something called rhabdomyolysis. That happens after really, really strenuous exertion, where muscle components break down, leak into the bloodstream, and then end up in the urine. Certain kidney problems, or even eating huge amounts of fava beans or rhubarb could also lead to that color. So yeah, definitely unusual signals from the body.
So what we've unpacked today, it really shows that the color, the characteristics of your urine, it's like this little window, isn't it? A dynamic dashboard offering these surprising glimpses into your health or just what you've recently eaten or taken. It's not the whole story, obviously, but it is a remarkably powerful first signal, like a quiet daily report from your internal self. And it really is all about mindful observation, just paying attention to these direct messages, not, self-diagnosing or jumping to scary conclusions.
That's absolutely the core point. It's about finding that useful vigilance, that awareness, without letting it slip into unnecessary anxiety. Our bodies are constantly sending us messages, often quite subtle ones, and learning to interpret them, while it can be incredibly empowering. It gives you a greater sense of control and awareness over your own well-being.
And that, I think, leads us to a really crucial question to ponder as we wrap up this deep dive. How can you truly balance this helpful attentiveness to your body's signals with avoiding that undue worry? And perhaps most importantly, when do these simple observations cross the line? When do they become a clear, logical reason to actually go and seek a precise, comprehensive assessment from a healthcare professional?